USMLE style question, asthma and airway pressure. Question. A 24-year-old woman presents to the emergency department with acute shortness of breath, wheezing, and chest tightness. She has a history of asthma and reports that her symptoms worsened after exposure to cold air and dust. Her respiratory rate is 28 breaths min, and oxygen saturation is 92% on room air. Physical examination reveals prolonged expiration, use of accessory muscles, and diffuse bilateral wheezing. Which of the following best describes the intrapleural and airway pressure dynamics during an acute asthma attack? A. Intrapleural pressure is more positive during expiration, leading to airway collapse. B. Airway resistance is decreased due to bronchodilation, reducing the pressure gradient. C. Intrapleural pressure is unchanged, but increased lung compliance causes airway narrowing. D. Airway resistance is increased, requiring greater expiratory effort and leading to dynamic hyperinflation. E. Airway pressure remains stable, but increased mucus production impairs gas exchange. Answer and explanation. Correct answer. D. Airway resistance is increased, requiring greater expiratory effort and leading to dynamic hyperinflation. Explanation. Asthma is an obstructive lung disease characterized by bronchoconstriction, inflammation, and mucus production, leading to increased airway resistance. Expiratory airflow limitation, causing air trapping and hyperinflation. Increased work of breathing, due to prolonged expiratory phase and use of accessory muscles. During an asthma exacerbation, the narrowed airways cause increased resistance to airflow, requiring greater expiratory effort to overcome this resistance. This leads to increased intrapleural pressure during expiration, which can cause airway collapse and worsen obstruction. Dynamic hyperinflation due to incomplete exhalation, increasing lung volumes and work of breathing, worsening ventilation-perfusion mismatch, leading to hypoxemia and increased CO2 retention in severe cases. Why not the other choices? A. Intrapleural pressure is more positive during expiration, leading to airway collapse, partially true, but the primary problem is increased airway resistance and air trapping, not just airway collapse. B. Airway resistance is decreased due to bronchodilation, reducing the pressure gradient. Incorrect. Asthma involves bronchoconstriction, increasing airway resistance, not reducing it. C. Intrapleural pressure is unchanged, but increased lung compliance causes airway narrowing. Incorrect. Asthma does not increase lung compliance, it increases airway resistance. E. Airway pressure remains stable, but increased mucus production impairs gas exchange. Incorrect. Airway pressure fluctuates significantly due to airway obstruction, and mucus is a contributing factor, but not the primary cause of obstruction. Key learning points. Cat. Asthma increases airway resistance due to bronchoconstriction, mucus production, and inflammation. Increased expiratory effort leads to dynamic hyperinflation and air trapping. Airway collapse during expiration worsens obstruction and increases work of breathing. Patients experience prolonged expiration, wheezing, and accessory muscle use. Treatment involves bronchodilators, β₂-agonists, corticosteroids, and oxygen if needed.